Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Robotic surgery is one of the latest steps in medical technology that allows skilled surgeons to perform procedures that were previously never thought possible. On today's show, we will learn more about robotic surgery, the benefits of this technology, and what cases surgeons perform using the robots. We are pleased to welcome Dr. Than Srinivasan, Chair of the Surgery Department at Robert Wood Johnson University Hospital, Somerset. We also welcome Dr. Pooja Patel, a board-certified robotic and general surgeon. Welcome to the show. Thank you for being here, both of you. First, for the audience, can you tell us a little bit about your background and where you guys are currently practicing medicine?
Good morning, everyone. I am Dr. Srinivasan. I am a general oncologist surgeon. I'm exclusively specializing in robotic surgeries, and I have been in practice at Robert Wood Johnson University Hospital, Somerset, over 20 years. And it's an amazing place, and we are happy to talk to you all today.
And Dr. Patel?
Good morning, everyone. My name is Dr. Pooja Patel. Originally, I'm actually from the area. I grew up in Elmwood Park, New Jersey. I did all my training in New York. I was fortunate enough to be able to do a fellowship up in Hackensack University for robotic surgery. And I just started practicing with Dr. Srinivasan down here at Robert Wood Johnson Somerset Hospital, doing robotic general surgery.
Thank you. Thank you both for being here, and thank you, Ken, also for all of the wonderful work that you guys do. When I graduated medical school back in 1984, there was no such thing as robotic surgery. Everything was opened. People were in the hospital for a gallbladder for 6 days to possibly 2 weeks. That's really changed immensely with the advent of technology and now the advent of robotic surgery. Can you tell us, start a little bit of an overview of the common surgeries that both of you do at RWJ University Hospital in Somerset?
Thank you, Doug. As you know, this is a very well-managed community hospital nestled in Somerset County. We are a community hospital, and we are proud partners here. And we do general surgery and oncology surgery, and there are other surgeries done here, including urology, orthopedic. The list is endless. Although we are a community hospital, we specialize in complex surgeries in the hospital, which is unique. Our larger volumes are exclusively general surgery from hernia, gallbladder, colectomies from general surgery part. And we distinctly hold a pride in saying that we do also complex surgeries. And any surgery you name, it's being done here at this moment.
As those of us who are part of RWJBH medical system, we actually are very proud of what you guys do. I wouldn't think of using a different surgeon for robotic surgery after I've seen the great work you've done on our patients. You've done work in general surgery, prostate surgery, urology, urogynecology, colorectal surgery. You do everything that I actually need with my patients.
Thank you. Yes, we do. And we provide good quality care, and our patients come back to us, and we are very proud partners.
I would actually say excellent care rather than good care. And it's from this time that they're first seen, the time that they've got nurse navigators that help, they've got all of the ancillary department with them, and then of course they've got you and your group that does the surgery.
Yes. Exclusively when it comes to general surgery, it's me and Dr. Patel and Dr. Prichkovsky, who's also a robotic fellowship trained surgeon. She got called into the operating room. In addition to general surgery, I want to make sure that we represent also urologists, Dr. Patel, Dr. Tave, and Dr. Samiel Samira. There are many surgeons who do urological surgeries. And we also have a gynecologist surgery, Dr. Ruth Stevenson, who works in university and here. She also do gynecology surgeries. So we have a mixture of all specialties done robotically at this moment, and colorectal surgery, which we do practice. Thank you.
So the hospital first started using robots in 2010, and now there are 3 robots at the University Hospital in Somerset. How has this technology expanded our surgical capacities?
It's great. So I can't go to our hospital before I tell. So the robotic surgery itself, it picked up in 2000, although the progress was started in 1980. For general view, it was originally designed for use in military to provide immediate care on the battlefield from remote surgical station to save amputations, to save legs. This originally was done by NASA and Stanford. That's where we got this application from. Of course, it's being used in civilian purposes, which we are proud of. That when we started, like exactly you mentioned, we started doing with our first robot prostatectomies. As we progressed, as this evolves from 2000 to 2025, the application expanded, which was originally approved for gynecology, urology. Now, general surgery has become the dominant partners. There's no such thing in the abdomen, cut and open and stitch anymore. Everything is minimally invasive, which is made possible. Compared to the laparoscopic surgery, robotic surgery has a higher chances of getting everything minimally done because the conversion rate is very low. So once general surgery joined urology and gynecology in the bandwagon, our volumes tremendously increased. We were with one and started with the second. Now we have a third. There is a reason for it. The volume of surgery done in general surgery increased over 70% of the total volume. And for a small community hospital, we became the high volume robotic general surgeons. And we became popular, and our outcome of the quality is excellent. And we became the top 3 performers in our own system. So to save patients waiting for surgery longer time, the administration and the education part, we all team together. As this expands, we were supported. We got the second robot, and we have now the third robot, which is few months old. That is the latest. We call it DV5. And so we earned it, we support it, we use it to provide a top quality care. For a small community hospital, 3 robots expansion is an amazing feat. We are all proud of it. We thank all the nursing and administrative staff for make this happen. We wouldn't have done with all people like you. You provide great community care for your patients and your support. Everything grows and provide excellent care for our community. So this is where we are with very, very focused precision health and high volume small community hospital. We are unique in this community. Compared to many other hospitals, we're distinct, we are outstanding when it comes to general surgery.
And again, being in a community hospital makes it so much better for the patient, because this way they don't have to travel miles and miles and miles to get a excellent outcome. They get the excellent outcome and they can go right back to home. They don't need to be traveling back and forth follow-ups. It's unbelievable what can be done in a small community hospital. They don't need to go to New York or Philadelphia.
I think you said it very well, absolutely. And we are all for it. and we are proud of it. I'm glad your patients are very thankful to that too.
And again, has a lot to do with the fact that administration, as part of RWJBH, understood what the future was and understood about improving quality care by having experts such as yourselves doing robotic surgery, understanding robotic surgery, and getting more robots as it expanded.
I think that's absolutely correct. It's a teamwork, and it's a large investment, and it provides a quality care, and the administration understood us, and we are providing the skills and expertise, and the whole system works with us, and we are proud of it.
So what type of training do you receive specifically for robotic surgery?
So I was fortunate enough to be able to do an MIS robotic fellowship. It's a growing field and a relatively new fellowship that's offered to residents and growing in popularity, where you spend a year really focused on just honing in on your skills and learning from really experts in the field about robotic surgery and its applications. There's also a great community of robotic surgeons all over this country where we're able to collaborate, virtually and in person to learn from each other about our experiences on robot.
So just so the audience knows, you first completed 4 years of medical school, and then what came after that?
So after that, it is 5 years of general surgery, and then 1 year of focused MIS robotic surgery.
So it's a lot of time for you to get to the position that you are and to be the expert you currently are.
Absolutely. We do over 1,200 cases in general surgery, and I personally have done about 500 cases in my fellowship.
So since Dr. Sarah Brskowski is not here, she has a very similar training like Dr. Pooja Patel, and she has done over 1,000 cases. And I have done over 1,300 cases, which is unique in any system. Especially recently, our volume with additional robots is only going to increase. And unlike Dr. Patel and Dr. Pruskowski, in my training, we had no robotic training. So I was trained by computer modules, animal labs, and then we went for a supervised training, supervised surgeries. Although the principles are the same, we got very good at it. That's part of my training. And so overall, it's very controlled. We have a strict criteria for doctors to operate on the robot in the hospital. The quality control is very strict and well maintained. There's a standard protocol we follow. So it's amazing.
So again, not only are you experts, but you do follow guidelines, you follow clinical guidelines, you follow when you make sure the follow-ups are done, and then you're graded basically on that to make sure we still maintain excellent results.
Absolutely. We follow the protocol 100%.
And for the person, what is the average length of a procedure with robotic surgery for general surgery, prostate surgery, urology, urogynecology? Do you know what the average lengths are?
So I can speak to the general surgery average lengths. Depending on the complexity of each case, the average gallbladder takes about 30 minutes. And then the average inguinal hernia probably takes about 45 minutes or so. And that's including both sides. It really speaks to the team that we work with in the operating room, being well-trained and facile with the equipment and really cutting down that average length of procedure.
And also, Doug, initially when robotic surgery was getting into the community, there was a misrepresentation. It's going to take a long length of time, which is not true anymore. It's practice and facilitating training and getting the nursing staff to work as a team. It only shortens the time. So it's a misrepresentation, and which has been proved beyond doubt. And we only get better in timing and efficiency. So it's an excellent tool.
Which is great because, as I said, as a medical student, I can tell you I held livers and in gallbladder surgeries for 6 to 8 hours.
You're right, and we do splenectomies on robot. all procedures are done very efficiently too.
And the benefits of robotic surgery?
We can do complex surgeries in people with morbid obesity, surgeries that were with a high morbidity, we done with the less morbidity, less invasiveness, with a remarkable outcome to start with on a bigger picture. Number two, I would say the blood loss is minimal, almost zero. It's because you're on a magnified field and the precision is accurate. Basically, what is a robot? Robot is basically a computer-assisted device, an instrument operated by the surgeon with extraordinary precision, magnification, and also what we call as endo wrist. Unlike our wrist, this has got a multiple movements it can reach in a difficult location, and the visual field is very good. It's technologically a marvelous thing for us surgeons. And the next one I would say is, yes, people would argue, hey, you could do this in a laparoscopically. We have this question all the time. But when laparoscopy, which is a two-dimensional, robot is three-dimensional. So we learned the conversion rate, which means converting a laparoscopy to open surgery, was higher, whereas in robotic surgery, conversion to this minimally invasive surgery to open surgery is markedly reduced. And the next part I would add is length of stay in the hospital minimized almost over 30%. If a patient stays for 3 days, they stay for 2 days. And then outpatient surgeries, almost 100%. You don't need to keep them because the pain control is better, the patient comfort is better, and we have learned to give how to manage their care, educate them upfront, and we find more success in this part of minimally invasive surgery compared to open surgery and even to laparoscopic surgery. So this is endless, but these are the highlights. Yes, especially we find benefit when we do complex general surgeries like colon rectal surgery on an obese patient. Their outcome is tremendously improved in addition to an average population because endorist, superior visualization, and mechanical improvement. And it's a science and technology we embraced, and we benefit, and our skills get transferred and benefit the quality care for our patients. It's amazing, and we are truly finding it valuable as we do more and more cases.
Yeah, I would just like to reiterate some of those great benefits. And for the patients, the real benefits are length of stay and postoperative pain, smaller incisions, being able to go home sooner and get back to their, regular day-to-day routines.
Tell us then, a candidate for robotic surgery. What makes a person a candidate for robotic surgery?
So I'll give you my opinion first, and everyone is a candidate for robotic surgery. There is for any abdominal surgery, our first consideration is robotic surgery. In the earlier days, when we were doing minimally invasive surgeries, if patients had multiple surgeries, we tried to avoid them operating through keyholes or minimally invasive surgery. That was true for laparoscopic surgery. What changed in robot is, even in patients with the previous surgery, we are able to get through clear radiations, still do more minimally invasive surgery successfully. So we consider everybody for robotic surgery, but what we consider as high risk, we take precautions, we prepare them for the open surgery. There is no harm in open surgery as long as at the end of the day, there is no compromise and we want to bring the outcome. So if there is no reason to do robotically, at some time you realize you need your bare hands to feel it, is absolutely necessary. So, but as far as I'm concerned, we consider everybody robotic surgery. It's not going to be 100%. There are going to become some exceptions. Is that right, Pooja?
Yeah, I agree. I think, and we mainly do, treat adult patients, and that's where the indication truly lies. So obviously greater than 18 years old. And I would say everyone is a candidate for robotic surgery, at least consideration for it. given the great benefits.
Are there risks for patients having robotic surgery?
Dr. Zinsky, as you know, anytime we use an instrument, knife, Bowie, every instrument, it's a mechanical device. This is a computer-assisted device. So initially, when they started in 2000, their fear was a mechanical failure, right? There's always there with anything we use in our life. So that's why we are in the operating room when, let's say, electricity shuts down or the machine doesn't work. We just dismantle the instrument, go back to a conventional treatment. At the end of the day, patient gets the treatment, the outcome is reached. So yes, but I have to tell you, they have improved the instrumentation. They have almost, I want to say that zero incidents, okay? Because this as a backup for a backup and a backup for safety, as well as the latest instrument we call DB5 has so superior that you can feel the tactile sensation. We call it haptics. Haptics was not there in the earlier instruments. You won't feel the touch feeling. But the latest instrumentation with artificial intelligence, we can feel like your finger is there. So this is an amazing feat. And yes, it's not zero. To summarize, mechanical, we always are prepared for it. And we are more than prepared for it. So I'll give an example. When you go to major conferences, international conferences, a patient is in Brazil. The surgeon is in Japan, Korea, Chicago, and in Brazil. So the Brazil team starts the surgery. The Japanese guy does his part. That's what he specializes in. The Korean guy then passed on to the American surgeon. These are all by electronically done. This is possible in the future, but it's currently, as surgeons, we have to be in the operating room. I can't sit at my home do the surgery, but it is possible, provided the internet is 100% as basically electronic communication. It's amazing. We do it in the international conferences, but for mechanical failure safety, we are always in the room with the patient.
And after the surgery is over, what does the post-surgical care look like for most patients, and what's the recovery period look like?
Yeah, so most patients that come in for, elective procedures like gallbladders, hernias, it's a same-day procedure. They come in the morning, we do the surgery, and they're able to go home that same day. What we advise patients, for their recovery is, the first week of recovery is probably the toughest, where you feel the effects of the surgery the most, needing some pain medications to help, with that recovery. After week 2, patients feel really back to normal and kind of feel like they're able to go back to their routine and go back to doing what they normally do.
So again, nice thing is it's so much quicker recovery. As you said, you're getting to things that you couldn't get to with regular open surgery. They're being done much faster. I like the fact that there's so little blood loss there. So I can consider when someone's a Jehovah's Witness to send them for robotic surgery, because there's always been that concern with someone who's a Jehovah's Witness. And then, of course, the recovery period afterwards.
You are right. We have done last year alone that 920 cases robot. Out of that, 700 is general surgery. Now, we can tell our own personal experience. We have done over 5,000 cases since we had the robot. The last year alone is 900. So what does it mean is when we reoperate on these patients, we also find very little scarring when we re-enter the belly. They heal with very minimal scarring, and it's amazing. Unfortunately, all of us live a longer time, and people need more than one surgeries. So their surgeries, subsequent surgeries also done minimally invasive. I think it's a remarkable improvement in surgical innovation and technology on adding to all the other benefits Dr. Patel said.
And what sets robotic surgery apart from minimally invasive techniques?
I think so. Minimally invasive is kind of an attitude towards surgery and trying to minimize the surgery we're providing patients and still giving them that same benefit as open surgery. Robotic surgery allows us to do more complex surgeries, as Dr. Srinivasan mentioned, that, with the traditional laparoscopic, in the past, we haven't really been able to do, or very few experts have been able to do.
Right.
Now, with the proper training and having a greater number of surgeons, we're able to provide smaller communities like Somerset, that same access to these expert level procedures, right in their neighborhood.
Right. Robotic, definitely the conversion rates to open surgery is less. The scarring is less done. As you know that we have a new pavilion unit with the private, with a high-end hotel-like feeling. You don't feel like you're in the hospital. And these patients go home. I don't think many of them see this new complex. When we keep these colon patients after surgery, they love the environment. They don't feel like they are sick in a hospital. They feel the environment we have provided in our hospital, in our new surgical unit, is calming for them. They don't feel like a sick patient. They make effort to move around like a normal person. So in addition to what we do in our operating room, our hospital has extended their post-op care remarkably well. And this is a recently opened unit. Our patient experience can be explained better than by patients. Unfortunately, you will hear more from your patients and talking about it. And as they come out of the hospital, this is a new unit and it doesn't feel like you are sick in a hospital. So I wish we hear more about it from you and others later about it. I hope your patients hear this and tell this to you. So.
I hope my patients do also. I'm thrilled that the leadership at RWJBH University at Somerset Hospital has done things like this to make the patient experience as great as possible. They have a terrific atmosphere, they have terrific surgeons, they have terrific collaborating nurses, clerks, etc. with them, and they have the best outcomes possible because of everything that's put into it. I want to take this time to thank you both, and thank you for everything you do for the community, for the patients, and for RWJBH Medical Group, and both RWJBH University Hospital at Somerset.
Thank you, Dr. Asinski, and Dr. Pskowski is not there, so Dr. Patel and I would like to thank all of you listening to us. We are available if anybody has any more questions through our office. Thank you.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about surgical services at Robert Wood Johnson University Hospital, Somerset, please visit www.rwjbh.org/Somerset.